Hello, welcome to Future CRNA Learning Solutions. This week, in our weekly lecture series, we are going to be covering inhalation agents. So, to get it started, inhalation agents are one of the most important foundational topics in anesthesia because these agents are what allows us to induce and maintain general anesthesia in a controlled, predictable way. Inhalation agents are administered through the lungs, and they allow us to produce a reversible loss of consciousness along with sedation, hypnosis, and immobility. One of their biggest advantages is that we can adjust the anesthetic depth in real time, simply by changing the concentration that the patient is breathing. That level of control is what makes inhalation agents such a cornerstone of modern anesthesia practice. Now, before we dive into each individual agent, I want you to understand two core concepts. If you understand these, everything else becomes easy. We have the blood gas solubility and oil gas solubility. Let's start with blood gas solubility, as you can see it right here. Blood gas solubility determines how fast an anesthetic goes from the lungs into the brain. So think of it as the speed of the anesthetic. And the key rule is this: low blood gas solubility means fast induction and fast emergence. High blood gas solubility means slower induction and slower recovery. So they are completely inverse. Now I want to give you a simple way to remember this, and this is how I personally remembered it while I was in CRNA school, because it does get a little bit complicated. So think of these agents like vehicles. So desflurane, that's right here, this agent, the way I remembered it, it's like a Formula One car. So it is extremely fast, and it can also brake very, very fast. So it has the lowest blood gas solubility of 0.42 of any of these agents right here. So what that means is it reaches the brain quickly and also leaves the brain quickly. So the onset is rapid and the wake up is rapid. The next anesthetic agent is sevoflurane, and think of it like a sedan. So it's still very fast, still efficient, but it's more smooth and more controlled, like your regular sedan car, little picture I drew right here. And again, it has a blood gas solubility of 0.65. So it has a slightly higher blood gas solubility than desflurane, so it's a little bit slower, but again, still very fast overall. And clinically, it is very well tolerated. This is the agent that we use, in my opinion, probably 90% of the time, and we use it for mask inductions in pediatrics. And then isoflurane is like a truck or a semi-truck, as you can see here by my picture. It's a lot slower. It takes a long time to get up to speed, and then it takes a long time to slow down. It has a lot of inertia. And again, that's because it has a higher blood gas solubility of 1.4. So the induction is slower, emergence is slower, but again, it's stable and reliable, which makes it useful for longer cases. And then we have the nitrous oxide. It's also very fast, but it behaves a little differently because it's not a very potent anesthetic by itself. And usually we have to use other adjuncts with it or in combination with the other agents, sevoflurane, desflurane, or isoflurane. And we're going to cover that a little bit later on. So again, the takeaway of all of this: blood gas solubility tells you how fast the anesthetic is. So again, you have your speed here. You have the desflurane, it's the fastest. Then you have your nitrous, you have your sevoflurane, and then you have your isoflurane. That's essentially it. Now let's move on to the second major concept: oil gas solubility. Oil gas solubility determines the potency of the anesthetic. And that is going to be right here. That's the oil gas solubility, and then this is the potency of each anesthetic. The key rule here is high oil gas solubility means high potency. Low oil gas solubility means low potency. And clinically, we measure potency using MAC, which stands for minimum alveolar concentration. And essentially what MAC is, it's the concentration required to prevent movement in 50% of the patients in response to a surgical stimuli. So here's the relationship. Low MAC means high potency, And we can see here moderate. Here we have a MAC of 6%, and it is low potency. And then high MAC means low potency. So for example, isoflurane has a high oil gas solubility. It's 99, which makes it very potent. And this is also why its MAC is also low. It is around 1.15. So for example, isoflurane has a high oil gas solubility around 99, which makes it very potent. And again, its MAC is also low. It is around 1.15. Sevoflurane is moderately potent with an oil gas solubility of around 50, and it has a MAC of 2%. Desflurane has a lower oil gas solubility. It's around 18.7, as we can see right here. And it is less potent, has a low potency, and it has a higher MAC, which is around 6%. And then nitrous oxide has a very low oil gas solubility, as we can see right here, with a MAC greater than 100%. And with these numbers, it makes it a very weak anesthetic. Which means that, like we said earlier, it cannot be used alone for general anesthesia. You kind of use it as an adjunct. So if you remember one sentence, blood gas tells you how fast you get there. Oil gas tells you how strong it is. Again, for the blood gas, we said that's the speed. We have the desflurane, nitrous, sevo, isoflurane. The oil gas solubility tells you the potency. So the most potent anesthetic is going to be your isoflurane, then sevoflurane, then it's going to be desflurane, then nitrous. Now, let's talk about how these agents actually work. All inhalation agents depress the central nervous system. They enhance the inhibitory pathways primarily through GABA receptors, and they reduce the excitatory signaling. Nitrous oxide is a little different. It primarily works on the NMDA receptor antagonist, which is why it provides such strong analgesia, but it's a very weak anesthetic. Now let's talk through some of the physiological effects of each of the agents, starting with the central nervous system. So these agents, they reduce the cerebral metabolic rate. And however, some agents like sevoflurane and isoflurane can actually increase cerebral blood flow, which may increase intracranial pressure in certain patients. So this is something you need to be aware of clinically. Next, the cardiovascular system. Most volatile agents cause a decrease in systemic vascular resistance, which leads to hypotension. Desflurane is unique in that that rapid increase can stimulate the sympathetic nervous system, causing tachycardia and hypertension. And it can also actually increase the sympathetic nervous system by irritating the airway. Then we have the nitrous oxide, on the other hand. It tends to preserve cardiovascular stability, which makes it useful in certain patients. Now onto the respiratory system. These agents generally depress ventilation. They decrease the tidal volume and respiratory rate. Desflurane and isoflurane can also irritate the airway, like I said earlier, which can lead to coughing or laryngospasm. And this can also increase the tachycardia and the increase in the sympathetic response system that we mentioned. So this is why we typically avoid using these type of agents for inhalation induction. Sevoflurane, in contrast, is a non-airway irritating agent, which makes it ideal for mask induction, especially in our pediatric patients. Now, let's talk about each agent briefly. Sevoflurane is one of the most commonly used agents. It has low blood gas solubility, which means rapid induction and recovery. It is smooth, non-irritating, and ideal for mask induction. It also undergoes minimal metabolism, and most of it is exhaled unchanged. Clinically, it is widely used in outpatient and, like we said, pediatric anesthesia. Isoflurane is more moderate in speed. It has a higher blood gas solubility, so onset and recovery are slower, but it is more potent and very stable. It is also cost effective, which makes it very useful in a lot of the longer procedures. We also use isoflurane in a lot of the neuro cases that we do, just because it has a lot of neuroprotective features. And then also with isoflurane, it can irritate the airway a little bit, not as much as the desflurane, so it is not ideal for induction. And again, desflurane is the fastest agent, has a very low blood gas solubility. It's rapidly on, rapidly off. It also allows for very precise control of anesthetic depth. However, it is an airway irritant and can cause sympathetic stimulation, so it needs to be used carefully. And then finally, nitrous oxide. And again, nitrous oxide is very unique. It provides a very strong analgesia, but relatively weak anesthesia. It has a rapid onset and recovery. It is often used as an adjunct to reduce the amount of other anesthetics that are needed. However, it expands air-filled spaces, so it is contraindicated in conditions like pneumothorax or bowel obstruction. And also, it can affect vitamin B12 metabolism with prolonged exposure. Now, let's finish with some high-yield risks here. All volatile anesthetics can trigger malignant hypothermia, except nitrous oxide. So always be prepared to recognize and treat MH with dantrolene. Nitrous oxide can expand air spaces, which can worsen certain conditions. And all of these agents can decrease systemic vascular resistance, leading to hypotension. So to wrap this up, inhalation agents are a powerful tool that allows us to control anesthesia in real time. Blood gas solubility determines the speed. Oil gas solubility determines the potency. And understanding these concepts allows you to choose the right agent for the right patient and right procedure. And if you remember nothing else, desflurane is your Formula One car, sevoflurane is your smooth sedan, and isoflurane is your steady semi-truck. And that's how you remember speed. And then with potency, it's a little bit more work, but as long as you remember that the most potent anesthetic is going to be the one with the lowest MAC, that's going to be a quick way for you to remember that. So that's the foundation of inhalation anesthesia. And again, if you guys want to learn this more in depth, sign up for our course at Future CRNA Learning Solutions, and we look forward to seeing you there. Thank you.